We believe the recently enacted Accountable Care Act is a step in the right direction. It establishes for the first time in federal law the principle of health care as a right of all Americans. It also attempts to mitigate many of the most offensive practices of the private health insurance industry. But it is a work in progress. It is an expensive and complicated program. It does not do enough to control rising health care costs, which continue to spiral out of control. Many people remain unassisted and cannot afford meaningful health insurance, while others struggle to maintain coverage in the face of continuously escalating premiums despite enacted reforms. Lewis Carroll once wrote, "If you don't know where you're going, any road will take you there." We know where we'd like to go. Our vision for Maine's healthcare road will lead to a Maine where all Mainers have affordable access to the same high-quality health care regardless of age, gender, income, employment, or health status. Patients will receive treatment based on their health care needs rather than their insurance coverage. And doctors will no longer have their clinical judgment second-guessed by insurance company bureaucrats. Hospitals will offer services determined by the needs of their community rather than their need to generate revenue. No Mainer will be in danger of financial ruin because of health care costs or have their insurance canceled when they become sick. No Maine business will be at a competitive disadvantage relative to their domestic and international competitors because of uncontrolled health care and insurance costs. The legislature will no longer have to watch rising Maine care and public employee health care costs steadily erode its ability to address other critical priorities. These may seem to be ambitious goals. However, they are a reality in most other advanced countries. We hope to educate the people of Maine about ways to achieve affordable, quality health care for all Mainers, and we thank you for joining us.
Good morning. I'm Alice Knapp. I'm a former Maine health insurance regulator, as Julie said, and now run a solo law practice in Richmond. I speak on behalf of those left behind by federal health care reform. Maine is a small business state, and census data indicates I am one of roughly 104,000 Mainers who are self-employed. We are professionals, contractors, fishermen, artists, mechanics, bookkeepers, truckers, child and healthcare providers, and others performing as many jobs as can be conceived by imagination and initiative. Federal healthcare reform excludes sole proprietors from eligibility for the health insurance tax credits available to qualifying small businesses. Sole proprietors are also excluded from the small group market and are forced to buy coverage through Maine's individual health insurance market, where comprehensive coverage is prohibitively expensive. Even high deductible plans are expensive. If you are between the ages of 40 and 64, the only policy available for a premium under $300 a month in the individual market is Anthem's $15,000 deductible plan. While some call high deductible plans consumer-driven health care, I hold to the view that the only thing worse than being uninsured is paying to be uninsured. There are no premium subsidies available to help with the individual market's sky-high premiums unless you earn less than $43,320, which is currently 400% of the federal poverty level. For someone who earns $43,320, so you're at 400%, no subsidy, my $643 per month premium for the lowest available deductible Durago plan, the $2,500 deductible plan, would represent 18% of that person's income. Incremental reforms and coverage expansions have repeatedly and unacceptably left thousands of us to fend for ourselves, to become bankrupted by catastrophic medical expense, and to die prematurely for lack of access to health care others take for granted. In an economy crying out for job creation, those of us who have created our own jobs stand ready to help point the way to truly universal, equitable, high quality, and affordable coverage. Thank you.
Jim Miller is General Manager of Wood and Boat Publications, a small business with 33 employees in Brooklyn, Maine. He will speak on the effects of the uncontrolled costs of health insurance on Maine's small business community.
So just a little background. I've never come to the State House to do anything other than get a license as a notary. So this is really new to me. I think Joe found me because I wrote an editorial piece that the Bangor Daily was kind enough to dress up as an opinion piece rather than a letter to the editor. But basically, I've worked at Wooden Boat magazine for 25 years, and it's been a great run. We've always made a lot of money, and we did an awful lot for our employees. But we are in the luxury business, and over the last couple of years, we've suffered just like everyone else. And one of the things we needed to do was to cut back on our health care costs. At about that time, we took another major hit from Anthem. So what I'm going to read to you is part of the editorial piece that the Bangor Daily ran with a little update on what we had to do to cope with this. So good morning, I am Jim Miller, and I am the general manager of Wooden Boat Publications in Brooklyn, Maine. Our small company is comprised of 33 staff members who have health insurance, as do 17 of their spouses and 17 of their dependent children. In total, we have 67 lives, and that amount, and it costs us about $284,000 to cover those people. We had a renewal the 1st of May, and we experienced a 17% increase in premiums, which is an increase of $48,000. That's a one-year increase. Frustratingly, there is nothing we can do to offset this increase in cost, nor is there any way to understand why this happened. And when it comes to health insurance, we basically had one alternative to Anthem. And when Anthem decides to do something, it's usually a take it or leave it situation. There's no way you negotiate with a health insurance company on an increase. This year we decided we had to leave it. And we're gambling more of our own company money on self-insuring a major part of everyone's deductible. And I wonder why employers need to gamble on health care for their staff and families. We, Wooden Boat Magazine and Professional Boat Builder Magazine, are also faced with competition from international magazines located in countries that offer national health insurance. They are at a cost advantage, as are the U.S. magazines we compete against, who've chosen to drop coverage for their staff. I hope that affordable health care will bring some improvements to our company's health insurance situation, and like many others, we are trying to manage until 2014. History will only judge whether or not the new legislation is truly better than what we now have. My real hope for the future, and the main reason I'm participating in Maine AllCare, is to bring universal, not-for-profit health care to all Mainers, which will in turn help us to reduce and control our company's health care costs. That way, we can really concentrate on growing our business and bringing more jobs to the state of Maine.
Now I'd like to introduce John Newton. John will speak to the employee perspective on behalf of the Maine AFL-CIO, which has been a supporter of a universal publicly financed system for over 30 years. John? Want me to?
Hi, Chris. It's great to be here. The Maine AFL-CIO represents about 26,000 people in 150 local unions. And our task, our mission is to make changes in the State House, in our legislation, and do political work and be in solidarity with unions and working people that are fighting a particularly local struggle. So I'm here today to speak in behalf of all Maine workers, those that are represented by labor unions, and those who aren't. The message I bring to you today from the Maine AFL-CIO is that we are advocating for legislation that will put us on the path to having a Maine Medicare for All plan very soon. Not in 5 years, 10 years, but right now. And we must, before any more people, either those with health insurance or without it, have to choose between receiving the care they need, or heating their home in the winter, or feeding their children, or keeping up with the mortgage payments. We're all in the same boat. We should be in the same pool of coverage. But here's how we're in the same boat. Most of us work for a living, and we're all paying more money and getting less for insurance. But who else is in the boat? Anybody that has a budget. A small business person, a large business person, a town, a county, the state government. The cost of health insurance is hurting our economy, is hurting the individual. A way to talk about what we need to do is, I think, some of what I'm doing here, that we're all in the same boat, and we're all in the same pool, except there are a few sharks in our pool. And we need to get them out of the system. We already have a publicly financed system for poor people and old people. But as Dr. Hsiao said, I mean, what's an insurance company do? They're doing what they're supposed to do. You keep people out to make money. Or you don't cover things. You tell people, no, that's not covered. Or, you lied on your application. So what we need to do is get the sharks out. But the problem here is, we've heard about other countries who've developed single payer, but none of them had the powerful insurance industry that we do. So it's a big task to figure out how to do this. But we can do it maybe at the state level. Maybe we can do it in Vermont. Maybe we can do it in Maine. Because at the national level, we weren't sitting at the table. And it's clearly nationally, the insurance companies were sitting at the table. So we must recognize that we are all united in our need for a uniform, comprehensive, and affordable system that guarantees health care for all. And we have been a supporter at the AFL-CIO for publicly financed insurance for 30 years. And we're a leader nationally in the movement for single-payer health care. So starting today, let's move ahead and create a system that guarantees quality, affordable, universal health care for all Mainers.